Good afternoon, Ms. Hung and the Board of Directors. My name is Amanda, and today we would like to present our findings on penetrating the private healthcare industry by positioning the firm as the best hospital for cardiac and fertility services. Before delving into our discussion, it should be noted that this video is recorded prior to the coronavirus outbreak and hence it will not be taken into account. By doing a pastel analysis, we've identified 4 of the more important factors to find that politically there is a solid pillar of support from the government with My Healthcare Tourism 2020 initiatives and the newly introduced Budget 2020 that encourages subfertility treatment like the IVF. Socially, research shows that health and medical insurance sales has gone up by 2/3 over the past 4 years to reflect the rising significance of healthcare in our society. Legal analysis also notes that the PHFSA regulates the industry to promote fair competition. And lastly, the Malaysian mortality rate exceeds the worldwide rate by 5% for cardiovascular diseases, and with Malaysia as a preferred destination for medical tourism as stated by the MHTC, it proves a strong point for the industry. On to the competitive side of things, heavy regulation together with high capital costs for continuous R&D to remain competitive leads to a low threat of new entrants. Threat of substitution is low with many alternatives like acupuncture and Chinese medicine, but none of these can truly replace the expertise provided by hospitals. Shorter wait times is a value-adding novelty that public hospitals cannot really afford. As with the social trends in pastel, the perceived importance of healthcare is priceless. Customers are attracted to the availability of services and speedy hospitality, thus bargaining power of buyers is moderate with moderate competitive rivalry. Suppliers of the private healthcare industry include pharmaceutical companies, as it is expensive to procure drugs from specific companies, and the shortage of specialist doctors in Malaysia give rise to the pressure of maintaining competitive salaries, and this drives up costs. Upon our research, we've identified 3 major players to benchmark, and they are IHH Healthcare, KPJ, and TMC Life Sciences. Moving on to our SWOT analysis. Strengths of IHH include that it has entrenched customer loyalty by being the first ever hospital in Malaysia to launch a biplane X-ray system, as well as its implementation of the cardiac catheterization lab. KPJ has a strong financial position to capture investor confidence, not to mention its strong GLC status, with Johor Corporation holding 45.34% stake in the firm. Besides, its adoption of IBM Watson supports big data predictive analysis to help in delivering its short wait times. TMC, with its positioning as a one-stop solution for vaccination and travel medicine, promotes good employee engagement that contributes to its good specialist retention rate with its platform called Thomson Shine, which earns TMC its loyal customers. On the flip side, IHH's weaknesses is its resource concentration in major cities, and this overlooks minority needs. Turkey's lira crisis has placed IHH in a very risky position, with 1/3 of its revenue being threatened. KPJ is known for its expensive treatments and its risks pertaining to its aggressive expansion plans that are deemed too ambitious for what it is capable of. TMC is at a loss with a negative cash flows, suggesting poor management of funds by the firm. Next, we look at the opportunity and threats so that we can strengthen our own footing in the industry. I pass it over to Yi King.
Thank you, Amanda. I'm Yi King and I will continue the presentation. From an external perspective, there are opportunities. The demand for healthcare will be increased through the prolonged life expectancies and the Malaysia Year of Healthcare travel campaign driven by the government. An increase in demand is evident through expansion activities done by the 3 major players. Therefore, we should tap into this huge business opportunity in the healthcare industry. On the other hand, threats exist. In Malaysia, new drug price controls will increase the cost for providers. Internationally, the growing global trade tensions and risks will also affect the healthcare industry in some way. A gap analysis is a simple method of comparing the present state to a desired state, followed by determining steps that needs to be undertaken to improve that state. Firstly, specific improvement areas should be identified. There are 3 areas under our consideration, but we will solely focus on pricing for today. The ideal state would be to charge patients a reasonable price by being efficient in operations. Knowing the targets we want to achieve, in this step, we assess where the competitors are currently against those targets now. Competitors are currently charging high fees to the patients but are not being efficient. According to the statistics, 49% of total healthcare expenditure are by private healthcare providers, but only treats 30% of all inpatients and 5% of all outpatients. After that, we determine the gap and take actions that will close the gap between the current stage and the desired stage. To counter this problem, there should be transparency in hospital bills so that patients know what they are paying for. Moving on, we'll take a look at the current trends. There are about 1.4 million people who are aged 60 years and above in 2019, and it is forecasted that will increase up to 3.3 million in 2020. DOSM also found out that ischemic heart disease is the main cause of death for Malaysians. Malaysia's fertility rate continues to drop due to high living expenses. In response to that, the government allows couples to withdraw their EPF savings for assisted reproductive treatments, as well as tax rebates up to 6,000 ringgit for medical fees related to fertility treatment. As mentioned before, our aim is to be the best private hospital for cardiac and fertility. This is because this area has a huge potential to grow by looking at the current trends. Having chosen which segment to target, we now need to decide on how to compete in those segments. This is called the value proposition. It illustrates the range of positions that a product or service can take in the market based on dimensions that are important to customers. In our case, we'll focus our services on customer intimacy. Since we are targeting a niche market, we now need to charge a higher price to cover the costs and efforts for high customer intimacy and focus on their needs. The image that we want our customers to have is us as their best friend. However, on a relationship level, it is just enough to meet the standards for the service that we provide. Now, I will pass it on to my colleague Wei Zi.
Thank you, Yiking. Hi, I'm Li Wei-Ji. To achieve our value proposition, we have chosen 3 SMA tools and their linkages are as follows. Medical inflation is at 10 to 15%. To control costs, use time-driven activity-based costing (TDABC), where cost is assigned to resources consumed at each activity. The activities are identified by value chain analysis. Next, resources are allocated based on the time required to perform an activity. Time is then assigned to customers. Use customer profitability analysis to optimize customer mix and hence maximize profit. I will present the first SMA tool, TDABC. TDABC corrects the flaw of conventional costing and ABC, which is explained later. Conventional costing looks at the cost of just one aspect of a service. It budgets hospitals according to departments, inaccurately reflecting a patient's journey as a patient's whole care cycle crosses many departments. TDABC provides a seamless approach and looks at the whole cost of servicing a patient. Next, ABC assigns indirect costs by counting how many times an activity is performed. However, resources required to perform each occurrence of an activity vary, as some treatments are more complex. TDABC corrects it by looking at the time spent by the patient with each resource, like doctor and nurse. It is also easy and fast to implement as it only needs 2 parameters, the cost of supplying resource per unit of time and the time required to perform an activity. There are 8 steps to conduct TDABC. First, select the medical condition. We will use heart disease as an example. Then, identify activities using VCA and develop process maps of each activity in the patient care delivery. An example of a process map is as shown. Fourthly, estimate time for each process as shown here. Then, estimate the cost of each resource and their capacity. Calculate cost rate by dividing cost by capacity. Finally, calculate total cost for each patient, which is the product of time and capacity cost rate. After conducting TDABC, management can improve value by improving utilization of resources. As the resource capacity is incorporated into the equation, underutilization is highlighted for management action. Management can then eliminate non-value adding processes by substituting them with clinically equivalent or better procedures with lower cost. The process maps match clinical skills to processes and thus allow management to free up physicians and nurses to focus on their highest value added roles. TDABC also highlights opportunities to speed up cycle times and hence reducing demand for resource capacity. All of this lowers cost to hospitals, lowers medical bills to patients, and finally lowers medical inflation. However, management might face resistance to change when training employees on this new costing method. Besides, garbage in, garbage out. Now, I will hand over to Teo Xiao Qian.
Hi, I'm Teo Xiao Qian. I will present the second SMA tool, which is value chain analysis. Value chain analysis helps us to identify the hospital superior competitive advantage, which is differentiation for our hospital. Firstly, we conduct activity analysis to identify the key cost centers. It can be separated into primary activities and support activities. With activity analysis and cost analysis, we manage to conduct value analysis, value chain management and design, and most importantly, formulate strategies for a hospital. Here is where we map all the sub-activities of hospital into the portal value chain model. Then, according to the model, we figure out how the activities are interrelated, where the inefficiencies are, and we identify where the values are best being added. Next, we look further to the customer perspectives. Hospitals should emphasize on the value-adding activities which are highly valued by the customers. This can be done by survey satisfaction. According to our research, stakeholders play a role in helping to create a profit margin for the hospital. We identified 3 most immediate stakeholders that are related to the value chain model, which are payers, providers, and producers. Poor inventory control system contributes 28% of order mismatch in private hospitals in Malaysia. Medication storages are complex and difficult to maintain at its optimized level. Hence, we need to compare to our main competitors or our internal benchmarking to make sure we are at the optimum level of performance. If we found out that our activities costs are not in par and yet we are doing at our very best, then we will need to seek for alternatives which include outsourcing, vertical integration, and horizontal integration. Lastly, we formulate competitive advantages strategies with the characteristic of VRIO. We embrace leasing and rental-based opportunities to avoid large capital investments. We are highly aware that patient satisfaction is highly correlated to the profit margin, hence they are our main priorities. We are no longer a hospital that sells services, but we serve the people and facilitate best experiences for them through organized care around the patient, but not the tools, offer lifetime services, and risk-sharing models of reimbursements. Nothing is perfect. There are limitations in using the value chain analysis. One of the main limitations is it is time-consuming to finish the full analysis to identify the key differences and strategy drivers. Next, I will pass over to Sandra.
Thank you very much, Xiao Chen, and greeting everyone. My name is Sandra and I will be presenting the Customer Profitability Analysis. Customer Profitability Analysis allow firms to analyze the revenue stream and service costs associated to a specific group of customers, as profitability is ultimately determined by the customer usage of resources instead of only the cost of producing the goods or services. So, this is just a snapshot of the customer profitability analysis, which we will further elaborate in the later slides. The first step of CPA is segmentation of customers, which can be done via demographic, psychographic, behavior, and analytic segmentation. For our customers, the analytic segmentation is applied as it incorporates the customer's buying behavior together with their psychographic and demographic characteristics. Thus, we have identified 4 main customer segments, which is listed in this pyramid here. At the bottom of the pyramid is our biggest customer segment, which is the domestic outpatient, who subscribe to appointments with doctors for their specialized or general treatment. Contrastingly is the international inpatient, which is estimated to be our smallest customer segment. This patient needs hospital admission and assistance for accommodation and transport throughout their treatment. So, the next step in CPA is measuring the customer's margin. Costs are allocated to the respective customer segments, as different segments have their own distinct purchase pattern and specific ancillary services. The table here shows how profitability can differ between an international and domestic patient undergoing a similar specialized treatment. Besides, through the customer lifetime value model, firms can identify the present value of the customer future transaction to have a more accurate profitability analysis. Next is the customer impact. Being a hospital, customer satisfaction and trust is utmost important to the firm. Satisfied customers are more likely to encourage other people to use our services, and the opposite is the same. So, upon establishing the customer profitability model, firm can identify which customers are profitable and which are not. It's forecasted that the international patient would be the largest contributor of profit with 54%, whereas the domestic patient, despite being the largest customer segment, will contribute a mere 5% of total profit. So, with the customer profitability model, the company can now attune strategy accordingly. Firms can adjust their marketing strategy to capture more high-profit customers, such as international patients, and re-engineer their pricing strategy for low-profit customer segment. If such attempt still doesn't garner a desirable profit, the management should eliminate the segment as a whole. However, one of the main disadvantages of CPA is that there is practical difficulties in calculating costs of each customer segment, as oftentimes most customers have different combinations of services, which makes it difficult for firms to allocate accurate costs to the customer segment. So, In a nutshell, the board of directors should consider this long-term investment, as the healthcare industry itself is a highly profitable industry with an industry chaga of 6.4% of net margin. Thus, the firm can have a slice of this profit through the existing market gap, which calls for a private hospital that specializes in cardiology and fertility treatment. And this gap can be filled through the application of the strategic management accounting tool as mentioned before in order to form a leading private hospital in the cardiology and fertility treatment field. So, this slide here shows the resources we use throughout our research, and thank you very much for your attention.